A Kentucky woman who thought she was just having back pain found out it was a massive tumor on her spine. She thought she may never walk again. But I spoke with her about that surgery that gave her life back and the doctor who made it happen.
For Janice Huey, the pain began in April.
And one afternoon, I coughed and it felt like somebody was stabbing me in my back.
She thought it was just a pulled muscle, but the truth was far more serious.
So my physician sent me for an MRI. When I left going to Florida that next day, she called, that was on Friday. On Monday, she called me and told me that there was a mass on my spine.
An MRI revealed this, a massive tumor on her spine. It wasn't cancerous, but it was encompassing 90% of her spinal canal.
Almost dropped to your knees. And I knew I had to be strong. My son was with us. Is this going to paralyze me? Will I be able to walk?
It was in her thoracic spinal region, which is your mid-torso area.
Dr. Mahan Gyasi is the director of surgery at the Norton Neuroscience Institute. In the past 15 years, he says he's probably only seen 3 tumors ever grow as big and as fast as Huey's.
These types of tumors are probably less than 10% of tumors that we see in the neurosurgery field. And the degree to which her tumor had grown, I would say it's less than 1% of tumors get to this size.
Because of the tumor's location, Gyasi says time was in short supply.
It was fortunate that we did find it when we did, because ultimately at a certain point the spinal cord can't compensate anymore and people start experiencing permanent loss of function, even paralysis in the worst case scenarios.
Just 2 months after her first scans, Huey was on the operating table.
I was very nervous, very nervous.
Going into it, one of your fears was you weren't going to be able to walk again.
Right, it was. And there was no guarantee that I would be able to. If he slipped, that was the chance I had to take.
But he didn't. The 5-hour surgery was a success.
It's by far the best part of my job. Having a patient come in with significant problems, potential even paralyzing disease process, and being able to take her and perform an operation that dramatically will change the course of her life. It doesn't get better than that. It's so rewarding in itself.
After a short stay in the hospital and some rehab, Huey is back to walking as if nothing ever happened.
I'm a little slow, but not like I was before. So I am tremendously thankful.
She got her last clear scans in August and now won't need another checkup until later next year. Feeling blessed for her second chance, Huey says she hopes her story can remind others not to ignore a sign that something is off.
I just feel like if I hadn't done something at that point, I'd probably been paralyzed or in a wheelchair within a matter of weeks. I never in a million years dreamt that it was a tumor on my spine.